My name is Gabriela Calderon and I live in Visalia, California. Spanish is my first language. Both of my parents came from Mexico, so that is the language that I learned since I was a little girl. Yes, I have been asked to interpret for my parents. Since I was a little kid, I think I was about 10 to 12 years old when I started translating for my parents, even though I was still learning and I didn't really know how to translate. It wasn't something that they understood. They just assumed that we know how to speak English. We go to school here, so it is something that is expected for us when we're children to translate for our parents.
How did that make you feel?
It made me feel very uncomfortable because it wasn't something easy. I didn't know a lot of the terminology, especially when my parents will ask me to translate a legal document or a medical document. There was absolutely no way that a child can do that. We don't learn those terminologies at school. So it definitely made me feel very incompetent. And a lot of times, a lot of kids feel like they're dumb, that they don't know what they're doing, and they're supposed to know because we are expected to translate everywhere we go for our parents. I do not know all the medical terms in Spanish at all. I learned them in English. There's definitely no way that I know the terminology. I witnessed poor medical interpreting this past summer. I took my husband to the ER and I noticed the lady that was sitting across me in the lobby had a nurse and an interpreter. The interpreter was letting the patient know what was going on with her, and I was a bit concerned to see that there was a lot of pieces missing in his translation. I also noticed the patient, her facial expressions showed that she wasn't understanding what was going on or what he was trying to tell her. So that was a bit of concern. I even mentioned it to my husband when he was there. I was like, no, I don't think that's what he means, or he's not translating it correctly. And you could see that she didn't understand. So that's something recent. I am more concerned with the elderly population, also immigrants, new immigrants that come to the United States for the first time. I think they will be the ones that to be more concerned when it comes to interpreting.